Hi, my name is Madison, and I'm going to be your nurse today. First, I'm going to wash my hands, and then could you tell me your name and date of birth?
Wendy Holford, January 18th, 1968.
Okay, thank you. I'm going to provide you with some privacy, and I'll be performing a full body assessment on you today, okay? So first, I'm going to start with your cross lens. So I'm going to start with your radial pulse. Can't find it. We'll count for 1 minute. Okay, so I counted the radial pulse for 30 seconds and it was 60. Her pulse was 60 rate of BPM, and then her respirations were 18. So now I'm going to check your blood pressure. Pull it up. That's low. Go up your arm right here. Okay, first I'm going to pump this up. To see where I cut off the radial pulse. Okay, so it cut off at 100, so I'm going to pump it up to 130. Now I'm going to listen. So your blood pressure was 102 over 74. Now we're going to mute that. And I forgot to point out that I have my rubric near me, but it doesn't have any notes on it. Okay. Next we're going to move on to assess your eyes. I'm going to look at your eyes and then shine the light in them. So her pupils are round and equal. They are both reactive to light. And if you look here, and can you look at this and then look at the last one? Again. They're reactive to light and accommodation. Okay, so now I'm going to palpate your cervical knee and state any findings. I'm not finding anything. Okay, so first I'm going to palpate the pre-auricle, the post-auricle, occipital, tonsillar, submandibular, and submandibular. Okay, so all cervical nerves were non-palpable and less than a centimeter each. Okay, next we're going to move on to the cardiovascular exam. So, you know, lie down for this. Okay, so I'm going to be assessing your pulses. Sorry. And I would assess the carotid one at a time so that they don't block her blood flow and make her pass out. Okay. Okay. So I've done the carotid, the brachial, and now I'm doing the posterior tibial. Now I'm going to do the dorsalis pedis. Okay, and all those are rated with a 2+ and equal bilaterally. So next I'm going to listen to your heart sounds. First I'm going to use the diaphragm, and then I'll use the broom. I mean the bell. Okay, first I'm going to go to the aortic. And the pulmonic. First point, I'm going to go to the tricuspid and the mitral valve. And I would find an apical pulse here. And count that for 1 minute. Okay, so I just did it for 30 seconds and I'll times it by 2 and it was 60 just like her radial pulse. Okay, next I'm going to check or listen to your carotid arteries. Let me go back over, sorry, the pulses with my veil as well. So I'm going back to the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. Okay, and all pulses are equal. All right, now I'm going to assess the neck for the carotid arteries with the bell of -6. Can you breathe in for me and then out? And then hold it once you breathe out. Okay, good. Okay. Now, if you'll sit back up for me, I'm going to assess your lungs. Okay, so her transverse, or her anterior transverse, or anterior posterior way of her chest or thorax is greater than her transverse. Her respirations are normal, and there is no respiratory distress present. Now I'm going to listen to your thorax, your anterior thorax. So I'm going to listen for vesicular sounds up here. You can take a deep breath every time I put my chest up and you can breathe out. Vesicular will be over here again. Okay, bronchial is right here. Okay, bronchovesicular. Another bronchovesicular. Okay, so there are no adventitious breath sounds on the anterior side. So I'm going to move to the posterior side, okay? Go ahead. Each time I move my stethoscope around her scapula, that way I can hear her lung and not listen over both. And in a better setting, we would do this without a shirt on, so you wouldn't hear the scruff of the clothing and just hear her breath sounds. Okay, I'm gonna get under here to listen to the right middle lobe. Okay. And again, all breath sounds were equal and there were no adventitious breath sounds present. Okay, so next we're gonna go on to the general question. Oh, no, we're going to go to the abdominal exam. I'm sorry. Okay, so I'm going to lay back down for me. Okay, so first I'm going to inspect. So her abdomen area is, you know, like the shirt up there, is flat, so which is normal. There's no scaphoid or drooping present. I'm going to listen to all 4 quadrants for 1 minute each. Okay, so usually I would listen to each quadrant for 1 minute each, but in this scenario I just did it until I heard sounds. So her bowel sounds are active. If they had been absent, I would listen to each quadrant for 5 minutes and see if I heard anything at all. Okay, so now I'm going to percuss your abdomen. So I'm just going to do some light tapping. And you would hear dullness over the liver, spleen, or masses. You hear renaissance like over air, or tympany over air, and hyperrenaissance over gaseous dilations. So everything was good. No issues there. So now I'm going to palpate your abdomen, light palpation and deep palpation. Just let me know if you feel any pain, okay? So I'm going to do light. This will be only like 1 or 2 centimeters deep. Okay, there were no tumor or mass is felt with light palpitation. Now I'm going to go to deep palpitation, which would be 2.5 to 3 centimeters. Anything? Okay, so the patient felt no pain and there were no masses present, which is normal and good. Okay, so if you don't mind sitting up, I'm just going to percuss your kidneys. If you'll turn that way a little bit. So I'm going to blunt percuss her kidneys, just make sure there's no kidney tenderness. I'm just going to take my hand, okay, no pressure. Any pain there? Is there any pain there? Okay, so no pain is present, but if there were pain, that could indicate kidney infection, or if she had recently been in like a motor vehicle accident, that could cause some kidney tenderness. Right, now we're going to move on to the musculoskeletal exam. So if you will mind standing for me and just walking a few feet and walking back. Okay, you can sit down. So her gait was smooth, with ease, and there was no swaying or any issues with balance. Alright, so next we're going to check. Alright, I'm going to have you perform range of motion. Can you do internal adduction of your shoulder across your body? Can you do external adduction? Okay. Oh, sorry, you might have to lay down for this one. Can you do internal abduction of your hip? Okay, and then external abduction, which would be, there you go. Okay, so patient shows all full range of motion with no issues there or any crepitus with bones rubbing against each other. That is good. I'm going to test your muscle strength, so if you'll raise up against my hand, if you'll push down, if you'll press against my hand, and then pull back. Okay. So her strength is 5 out of 5, so no issues with strength or resistance. Okay. Next, I'm going to check your cranial nerves. If you can sit you back up for this. Okay, I'm going to test your trigeminal cranial nerve. So if you'll just clench. Okay, no issues there, no crepitus present. Next, I'm going to check the acoustics. I'm going to whisper 3 ears near your ears. And you're just staying back here, okay?
Full food running.
What?
Full food running.
I said all of it. All right.
Tiger trained listen.
Okay. So her acoustic nerve is intact. Okay, so now I'm going to test the spinal accessory muscle. So I'm going to put some weight on your shoulders if you'll just shrug up for me. Okay. And so the spinal accessory nerve is also intact. So now I'm just going to grade your deep tendon reflexes. So first I'll do the tricep tendon. So I'm going to put it there. So just have your arm limp. Okay. Test this and see grade your reflexes. Okay. Can you see that? Are you feeling anything? Okay, so her tricep tendon reflex isn't very present. Can you scoot back into your bigger than one? Well, there won't be that one, will they? Okay, so that one would be rated a 1, so that wasn't really present. But we'll check this, the patellar tendon reflex. There's a little twitch there. Calm down, Mom. Okay, so the patellar tendon reflex is considered a 3+. So that one was good, but the tricep we need to work on. Okay, so that concludes my full body assessment. So thank you for participating and thank you.